Yes, it's Wally, the iconic robot who meets Eva and falls in love with her. Have you ever been in love, Yes, I can see it now. 2 soft buns, cheese, tomato, my burger. Oh, Anyways, which organ is associated with love? The heart, right? It's kind of obvious. But the truth is our heart doesn't teach us to love. And most important, it doesn't break apart when somebody leaves us. Yeah, it's true. Our heart, the cone-shaped organ, is actually a complete workaholic. Throughout our lifetime, it tirelessly pumps oxygen and nutrient-rich blood to all of our body parts, just like a pumping machine. Come on now, close your palm and form a fist. Don't worry, I'm not asking you to fight. Our fist is approximately how big our heart is. It is located between our lungs, slightly tilted towards the left side. It is enclosed in a double-layered sac called pericardium. Does it taste like peri-peri fries? No, What does a picture frame do? It holds the picture in place, right? Without the frame, the picture would fall off. Just like that, the pericardium protects the heart by anchoring it to the surrounding tissue so that the heart stays in place. Pericardium also prevents the heart from overfilling. Now, just like Captain America's shield is made of special alloy, our heart is made of special muscle cells called cardiac muscle fibers. Now, let's dive in. Just like a tennis net divides the tennis court into 2 parts, the heart is also divided onto the left and the right side of a wall called cardiac septum. The right side of the heart is filled with deoxygenated blood, while the left side is filled with oxygenated blood. And this dividing wall prevents the blood from mixing. Each side of the heart further divides into 2 chambers. The upper chambers are called atria, while the lower chambers are called ventricles. Where are the sleeping chambers? Stop it, Let's first learn about atrium. Now, just like a postbox receives letters from multiple people, the atrium receives blood from different parts of the body. Thus, the atria are simply receiving chambers. They have thin muscular walls. Why thin? Do they believe in size 0? No, Their walls are thin, not requiring a lot of muscle tissue, because they only have to pump blood into the ventricles present right below them. Now, moving on to the ventricle. Just like the postman collects all the letters from the postbox and delivers them to their respective locations, ventricle also collects blood from the atrium and pumps it to different parts of the body. Thus, the ventricles are called discharging chambers. Just like coconuts have thick outer covering, ventricles have thick muscular walls. Why thick? Because the walls need more muscle tissue to generate enough pressure so as to pump blood out of the heart and distribute it to the entire body. Now, the left ventricle's wall is even more thicker than right ventricle's wall, because the right ventricle pumps blood only to the lungs, while the left ventricle has to pump it to the entire body, requiring much more pressure than the right ventricle. Now, let's talk about the valves of the heart. In total, we have 4 valves: tricuspid valve, bicuspid valve, pulmonary valve, and aortic valve. What happens when you hop onto a flight? Can you just change your mind?
Once again, a very hearty good afternoon to everyone, and hearty good afternoon to Sunita ma'am. We welcome you, and our guest, Dr. Makhija, is already with us. He has joined. So we welcome you, sir. We would request you to please switch your camera on, and we give you entire show in your hand.
Dr. Aman, बहुत बहुत स्वागत है आपका. Hearty welcome from Alcon International, and thank you so much. In spite of your busy schedule and your commitments, you have taken out time for children. We are really, truly honored to have you amongst us.
there's some issue with. Thank you, madam. Thanks a lot. And the honor is really mine to address the students, the young students. And I was just joined a minute back, and I saw there was some video going on the heart functioning and how the heart functions. So I'll try and keep it simple. If anyone has any doubts or any questions in between, feel free to interrupt me. So I will share the slides. Just give me a minute. How do I share the slides from this Teams thing? Any idea, madam?
Yeah,
Yes.
Can I share the slides?
Lavi ma'am, please guide.
Yes, sir. So, sir, there will be an icon, upward arrow icon in the bottom of your screen.
I've logged in from this iPad.
Yes, sir.
Yeah.
On the top, it could be, Lavi ma'am, beside the leave button.
Share screen.
Yes, ma'am.
Yeah.
So is my screen visible now?
Yes, sir.
Okay.
We got it.
Yeah. So again, a warm good afternoon to respected teachers and dear students. We'll be talking about how to keep your heart healthy. So a short brief. This is your heart speaking. I'm a very small organ, but probably I'm one of the most important organs of your body. I hardly weigh 250 to 300 grams, as much as the size of your fist. But I work day in and day out, all the time. I cannot afford to have even a break of a second. So it is most important that you look after your heart to keep yourself healthy through various means, whether it is exercise, proper diet, proper sleeping. So we'll come to that. Now, this term you will hear that is CAD. CAD means coronary artery disease. That in literal terms means heart disease or a blockade of the arteries of the heart. That is the most common cause of heart disease that we see these days, and it affects Indian individuals on an average almost 5 to 8 years earlier than the Western population for certain reasons. And it is estimated that almost 1/10 of our adult population might be having clinical or subclinical CAD or heart disease. So that's a huge number. And a lot of people, as high as more than 20 lakh people, they die annually because of heart disease alone. Now, what literally when we talk about heart disease, as you can see in this diagram, this is the model of the heart or the photograph of the heart. And these three things that you can see, these are the arteries. These arteries, they supply blood to the heart muscles. Now, heart supplies blood to the whole of the body, but for it to supply the blood properly, the muscles need to function properly. So the muscles require blood supply, and this blood supply is given by small arteries which are there on the surface of the heart. Two arteries on the left side, they are called LAD and the LCX. Let's not go into the details. And one on the right. So heart works properly if there is no significant blockade. When I talk of significant blockade, means any blockade or cholesterol accumulation in the arteries. What are the early warning symptoms of a heart attack? The person can have a pressure in the center of the chest, like someone has put a weight on his chest, or some pain which he has never felt before. He can have pain in the shoulders, neck, or the arms. Along with that, he can have a lot of sweating, nausea, and it's something very frightening is sometimes the first presentation of a heart disease is the heart attack itself. And then there's a term called as sudden cardiac death. Means that the person had chest discomfort and he dies within 1 hour. That is called as sudden cardiac death. And that can be the only presentation in as many as 50% of first heart attack patients. So it is always important to avoid such a situation, to avoid such a catastrophe, and to try and improve the things which can reduce this risk. So when you talk about CAD, CAD means heart disease, coronary artery disease. There are certain risk factors that we know which can lead to this problem. It can be a high blood pressure. It can be high cholesterol level, that is called as lipid disorders, diabetes or high blood sugar, tobacco use, whether it is smoking or chewing tobacco, obesity. Obesity means being overweight, mental stress beyond a particular limit, a diet, unhealthy diet, rich in fats, lot of salts, junk food, lack of exercise, and if a person has a family history, like if the heart disease happened in the parents, then the likelihood of happening in the children is there, or it has happened in the other siblings, brothers, sisters. Now, the risk factors for this heart disease, they tend to start or develop in the childhood itself. It's not that they only happen beyond 30 years, beyond 40 years. Unfortunately, we are now seeing even young CADs who are less than 30 years, young men and women, especially men, and they are coming up with coronary disease in a very young age. And it has been shown that this atherosclerosis means cholesterol deposition in the heart arteries, which leads to blockage. And it tends to begin in the childhood. And there's a positive relationship between the risk factors that we'll be discussing and the atherosclerosis in the adulthood. Like this is an example. Start from the blue thing, which is a healthy child, and because of a lot of unhealthy habits like eating junk food, watching too much of TV, or for now computers and other things, and lack of physical activity, the obesity. Obesity means gaining weight. Initially, the mild obese, moderate, severe obese, and these are the things which can predispose to heart disease in adulthood, coronary artery disease, diabetes, and other things. So definitely weight management for children who are overweight and obese is of paramount importance. Another thing is the having an idea about the cholesterol. Cholesterol is a waxy substance in your bloodstream that is ideally it is necessary for your body to function properly. There are certain essential functions which require cholesterol. However, too much cholesterol in the blood is not good, and it tends to accumulate in the arteries, especially the arteries of the heart, and can cause blockages. Like on the left is a healthy artery, on the right is an unhealthy artery because of the cholesterol deposition. The cholesterol, it combines with other substances and forms a plaque, which is thick, hard deposit. It can narrow the artery, make them less flexible, and can put the person at a risk for heart disease as well as brain stroke. Brain stroke means a blockade in the arteries of the brain. That is called the stroke, which leads to paralysis, and the blockage in the heart arteries which leads to chest pain and heart attack. And it is recommended by the American authorities as well as by the Indian Association of Pediatricians that screening for cholesterol should be done once between the age of 9 and 11 years, and again between the age of 17 to 21 years. This is not very commonly followed in India, but these are the recommendations. Selecting means a lipid profile or a cholesterol level should be done for at least once in this age group, and for other children who have a family history or other high risk conditions, like if they have diabetes or they are obese means overweight, or they have hypertension. And there are certain cutoff for the total cholesterol and the LDL level. LDL is a kind of cholesterol which is considered to be a bad cholesterol. So the acceptable limits, like if we get a cholesterol level, the cholesterol is just a simple blood test that is done in a fasting state after 6 to 8 hours of fasting. And we want a cholesterol level to be, total cholesterol level to be below 170, or the LDL cholesterol level to be below 110. And if it is really elevated, means more than 200 total cholesterol, then the child or the adult requires dietary modifications and some medications as well sometimes. Another risk factor for heart disease is the high blood pressure. Now, you would say that children don't have blood pressure, only the adults have blood pressure or high blood pressure. No, that is not the case. High blood pressure in children is what we can define as more than 95% of the children. When your pressures are higher than more than 95% of children of your age, sex and height, then that is considered to be a high blood pressure. It can develop in children because of the same factors as it develops in adults, like if you are overweight, if you are not exercising, if you are eating a very poor diet, and good lifestyle changes like eating a healthy diet, exercising can help reduce the high blood pressure. But even then, sometimes medication may be required. And it is recommended again by the American Heart Association as well as the Indian Academy of Pediatricians to recommend that kids should have a yearly blood pressure measurements. Now, blood pressure, you might have seen your parents or your grandparents measuring blood pressure at home. Now, blood pressure has two numbers. The first one is the systolic. It represents the pressure in your blood vessels when the heart is contracting. And diastolic, which represents the pressure in the vessels when the heart is relaxing. So there are two values. Suppose if you say 120 systolic and 80 diastolic, you say 120 by 80. And nowadays, automated machines are easily available for measuring the blood pressure. Another point, to keep your blood sugars healthy. We know that the digestive system breaks down the carbohydrates and the fats into sugars and fatty acids for energy production. If these blood sugars, now again, blood sugar is essential for brain functioning, for a lot of vital body functions. But if the blood sugars they go beyond a particular limit, then you're likely to develop a condition known as diabetes. The diabetes, you must all know, because India is the diabetic country or the diabetic capital of the world. It has the most number of diabetics in the world at the moment. Diabetes is a condition in which the body has problems either with making a hormone called insulin, which is a glucose neutralizing hormone, or it has a problem in using that hormone. And untreated diabetes leads to serious medical problems, and heart disease and stroke are among them. It leads to a lot of other problems. So why do we say that the Indians are at higher risk? Because socially we are people of 21st century, but if we go by the genes, we remain citizens of the Paleolithic era, which you are reading in your histories. And what are the ways in which we can go about trying to decrease the risk or minimizing or preventing the heart disease? So there are some simple lifestyle changes which we can do, and we have to start early so that we do not develop heart disease once we become adults, like healthy food habits, regular exercise, stress management, and avoiding tobacco at all costs. First and foremost, for children, dietary management. That is the most important thing. The problem is with so much exposure to media, there is so much of cold drinks, Coca-Cola, McDonald's, KFCs. There's a lot of advertisement of the food, more emphasis on eating out, increased convenience of food consumption. You can always order. It will come in 30 minutes, 20 minutes. A lot of availability is so easy. Large portion of foods being consumed, increased soft drink and juice consumption. All these are junk food, and they tend to increase your cholesterol levels, increase your blood pressure levels, increase your sugar levels, and in a way predispose you to heart disease. Now, one of the things which is grossly underutilized in our country is the use of soy protein. Hello? Madam, am I audible? Excuse me?
Yes, sir. Yes, sir. You are audible. Thank you, sir.
Okay,
yeah, and kindly keep your mics muted, please. Rest of us. Yes, sir, please. It's very interesting, G.
So, soy protein has been shown to reduce the risk of heart disease. And try and add soy to your diet, whether it is tofu, soy milk, or any other soy product. And it is considered to be one of the best plant protein, even in persons, even in children who do not consume non-vegetarian diet. It has all the essential amino acids which are found in a non-vegetarian diet. And why did we talk about this fast food thing? Because of this thing, trans fats. The fast foods are rich in trans fats, partially hydrogenated vegetable oils, margarine, fast food cookies, chips, cakes. They all have increased amount of trans fats, which increase the bad cholesterol. LDL is the bad cholesterol, and decrease the good cholesterol. HDL is the good cholesterol. LPA is another form of lipid, that's called lipoprotein A. So, avoiding fast food, very important. Avoid, even at home, we should advise our parents to avoid overeating and reuse of oil. That is another thing. It converts a healthy monounsaturated and polyunsaturated fats into trans fats, which again is highly atherogenic. Atherogenic means it increases the cholesterol deposition. Then we should all increase our fruit and vegetable intake. At least 3 to 5 servings of fruits and vegetables has been shown to reduce the risk of heart attacks by as much as 30%, cancer by 40%, and stroke means brain attack, by another 35%. So we should all try and increase the use of both raw fruits, raw, fresh, seasonal fruits and vegetables in our diet. Then there's another misnomer that nuts are bad for heart and they increase cholesterol. That is not true. In fact, nuts, most of the nuts like almonds and akroot, they are complete and healthy food. They are free from cholesterol and they contain a lot of healthy fatty acids like the MUFA, monounsaturated fats, proteins, carbohydrates, minerals, vitamins, iron, calcium, a lot of essential elements also. And intake of 20 to 40 grams per day of nuts has been shown to reduce cholesterol. And they should be included in your diet. A word about the drinks, healthy drinks. To say the least, the sweet drinks which are available in the market, they are high in sugar but very low in nutrients. They cause weight gain, obesity, and tooth decay. And these drinks make the child less hungry for a healthy meal. And then caffeinated food and drinks, they are not recommended for children at all because caffeine interferes with calcium absorption. And it tends to give initial artificial energy. So the energy drinks which are available, those are definitely to be avoided. Then coffee, tea, energy drinks to be avoided. Coffee, tea, if ideally should be avoided, or if at all, in a very limited amount, because they all contain caffeines which are not good for children. Similarly, the artificial sweetness, they are not to be used for children. Children are not supposed to take the protein supplements which which are prescribed in gyms and all those things. Those are strictly no for children. So this is how a healthy diet should look like. Your food should look like. It should be a lot of fruits, fresh fruits, a lot of vegetables, more of green vegetables, grains, whole grains. The emphasis on whole grains, milk. You can take milk, ideally low-fat milk, but even a fat-free or low-fat milk is ideally especially if you are overweight. But otherwise, milk consumption should be done. And then meats and beans for those who take non-vegetarians. You should try and choose low-fat or lean meat and poultry rather than the mutton, etc. Oils, again, you have to make most of your fat sources from fish, nuts, and vegetable oils. All vegetable oils can be used. And limit the use of solid fats like butter, stick, margarine, and other things. Physical activity will come in a while. So there's a ample evidence that there's a mismatch between a modern diet and lifestyle. Earlier, we were more active, eating less. Now we are totally inactive and eating more. And lack of physical activity attributes to about 1/3 of deaths from coronary artery disease in men and in women due to lack of physical activity. So, should all exercise, should all keep yourself active. It will strengthen your heart and cardiovascular system, reduce your risk factors for heart disease, improve your circulation, improve your energy levels. It will reduce your stress, anxiety, This we have discussed, and it will also increase your good cholesterol levels. You can do any kind of moderate or vigorous physical activity, whatever you like, whether it is riding, bike riding, swimming, brisk walking, tennis, jogging, whatever you like. And it is recommended that children and teenagers should get at least 60 minutes of moderate to vigorous physical activity every day, and that is a must, as important as having a healthy diet. And another thing, exercise and being active, it tends to reduce your stress levels and make you feel good. There are certain natural hormones which are called endorphins, which are produced by the brain when you exercise, make you feel good, make you feel better. And not like this. And a word about viewing of TV, computers, social media. Now, it has been shown that prolonged TV viewing has been associated with increased risk of diabetes, cardiovascular disease, and overall mortality. Mortality means risk of death. So, for the recommendations are that you have to, for children, that use of electronic items, iPad, TV, computer, etc., for entertainments to be limited to a maximum of 2 hours per day. In today's COVID time, I know it is not possible, but other than the normal school time, you have to really limit your screen time and avoid being sedentary. Yoga is an excellent technique that improves your concentration, improves your efficiency, quality of life, and also increases immunity and controls your stress. So yoga is probably a gift from India to the world, and if possible, we should all try and practice yoga for some time on a daily basis. And one more important thing for kids, should have a proper sleep, should have a proper schedule of going to sleep and waking up, because lack of sleep, we know it causes difficulty in memory, learning, it leads to increased irritability, lack of energy, and leads to undue stress, weight gain, overeating, a lot of problems. In fact, it has been shown that our mental performance degrades by 25% every 24 hours sleepless period. And last word about smoking. I know it is not probably relevant at your age, but you must also know that smoking increases the risk of heart attack by 2 to 3 times. And it is the biggest risk factor for sudden cardiac death along with diabetes. And this is one thing which can be totally prevented. Not only active smoking like cigarette, bidi, hookah, but even passive smoking by children when the adults in the house are smoking. It can lead to a lot of problems, heart disease, lung problems, and other things. It can lead to lung cancers, heart disease, and other respiratory problems. Even passive smoking for the other members of the family, especially for the children. And so it's an epidemic in a sense for the children. In India has reported almost 5 million child smokers, with almost 55,000 children start having regular smoking every year. So stay away from tobacco at all costs. And if elders in the family are smoking, then try and make them quit. We can avoid this thing, benefits from smoking. So to summarize, you have a simple 7 rules for the kids. Remember, you can stop the heart disease before it starts. This is the age in which if you start these measures, you can stop the heart or prevent the heart disease from happening. Make one change today and then you're ready to make another. So you have to be physically active every day, day in and day out. Eat a heart healthy diet. Keep a healthy weight. Keep your blood pressure healthy. Keep your total cholesterol healthy. Keep your sugars healthy, and avoid tobacco, active and passive, at all costs. So I'm open to questions. I can. How do I stop screen sharing?
The same button, sir. If you click on it, it will come back to its original position.
Yeah. Is that okay?
Yeah, and somehow your camera has gone off, so we would love to see you.
Yes, ma'am.
Yes, sir. Great.
We have Suryansh Tiwari waiting to ask you a question, sir. Yes, Suryansh, please put your mic open and you can ask your question.
Namita, ma'am, 1 minute if you could give me, I really want to convey
Yes,
my
ma'am.
profound
Yes, ma'am.
gratitude to sir. I think, the lovely way he has strung together everything from a child's point of view. Because normally, what is available on YouTube is enough material, but it's all, catering to adults. So you have really, tailored the entire presentation so that children learn from it. And towards the end, kindly enlighten my children because I'll be required to leave within the next 3 minutes for a meeting.
Sure.
I would request you to just throw some light on one part, sir. In case the child is home and he finds one of his family members suffering from some kind of cardiac problem, what action he can immediately take is also would be one of my questions to you. Because certain immediate actions, which when they are taken timely by the person who is around, really make a difference in saving the patient. So towards the end, you can take this up also, sir. But I'm really thanking you from the bottom of my heart. And thank you so much because of the, our teacher said hearty welcome. I'm saying a hearty gratitude to you. Over to you, Suryansh. You can start your question.
Thank you, ma'am.
Thank you, ma'am. Good afternoon, sir.
Good afternoon. Good afternoon.
I had 4 questions. So one of them was you referred to lipid disorder. What do you mean by lipid disorder?
Lipid is a general term for cholesterol. I'm sorry if I didn't emphasize that. Lipid means high cholesterol levels. That is what lipids means for you. So what we measure the lipid level, the cholesterol levels in the blood by a simple blood test, and we know the total cholesterol levels, the good cholesterol levels, the bad cholesterol levels. We always want our bad cholesterol to be low and good cholesterol to be at a higher level, or the ratio should be not above a particular level. So if that ratio is healthy, your bad cholesterol is low, then your arteries will remain clean. There will be no blockages there will be no accumulation of the cholesterol and no blockages which can predispose to heart disease. So that is what lipid means.
Okay, so one more question was scientifically we don't consider peanuts as nuts, but are they good for our heart or are they bad?
They are good for the heart.
Okay, so even peanuts are good for the heart.
Yeah.
And it's said that lamb is better in nutrition than maybe chicken. So is it good for our heart too?
No, I would not say that. The lamb, the white meat, that is the chicken, it has not been shown to be associated with the rise of the bad cholesterol. However, the chicken from the mutton from the lamb or from the goat, etc., it is found to be atherogenic. So it is definitely for patients, for our heart patients, we advise them to avoid mutton in all forms. So that way, from a heart perspective, the chicken is better than lamb.
Okay, so one last question was, you talked about walking is good for our health. So even though nowadays we can't go out, so my question was, going out and running is better or running on a treadmill?
Always going out and walking or running is always better. But if you can't do that, then the next best option is to run inside on a treadmill. So that's okay. But anyhow, you should do some activity. Doing an activity is more important than where you are doing it. If you're out and if the atmosphere is not good, there are a lot of pollution, then it's better to stay indoor and exercise rather than going out and doing it.
Okay, thank you, sir. That's all.
Thank you for asking that question. Ananya, I would like to ask you to now put up your question.
Good afternoon, sir. First of all, sir, I have 2 questions from you. So first is, there's a myth going on that, sir, I don't know if it's a myth or a true fact, that salt is bad for a heart. So, sir, is it really true or it's just a myth?
Yeah, thanks, Ananya, for the question. See, what the problem is that the fast foods and they contain a lot of salt intake. So so if we should salt below above a particular level, it's definitely bad for your body as a whole, for your heart as a whole, for your kidneys as a whole, because it will raise your blood pressure and leads to other problems, including fluid retention and things. So that it's not a myth. The salt is excess of salt is bad, but the other way around, that some people take it literally and totally avoid salt. That is also not good, because uh, the body does require sodium is an essential element in the body for a lot of processes, and some amount of salt intake is required. But what is happening is, because of the unhealthy diets, the salt intake, even if we don't add over and above what we are taking, we tend to consume a lot of salt. So for majority of the population, some sort of salt restriction is good. And you should not add raw salt over and above what has been cooked in the food. That is more important.
Okay, sir. So my next question is that it is often said that daily aspirin is a good way to prevent heart attacks. Is that so?
No, that has been proven now that the risk of protection from a small dose of aspirin is lesser than the risk of bleeding that happens because of the use of aspirin, especially bleeding from our gastrointestinal tract. So in a person who has no risk factors, I'm saying again, who has no risk factors and does not have diabetes, daily use of aspirin has now not shown to be superior to not taking it. But person who has had diabetes or other multiple risk factors, it may be prescribed, but only under supervision by the doctor. As such, blindly taking aspirin is not recommended at all.
Okay, sir. Thank you so much for putting up my questions.
Thank you. Now I would request Vibhu Kant, and I think this would be the last question to take, because we are crossing our time. So Vibhu Kant, please ask your question.
Yes, ma'am. Good afternoon, sir.
Good afternoon.
Sir, as you have said that increasing of screen time, watching TV, playing online games, increase our weight. So, sir, how can we reduce the screen time nowadays?
I know it's difficult to do it nowadays. That's why the school has in between asynchronous periods in which you are supposed to be away from your screen during that time. But I know these are difficult times, and but at least certain things you can do, that whatever school time is screen time for you. But beyond that school, you should avoid exposure to the screen after the schools are over. That is one way. Then secondly, even in your asynchronous periods, again, try to switch off the screen and try and move about. Keep yourself active in between. So maybe these are the ways, and then avoid eating while you are taking your classes or doing screen, because then you tend to overeat. So having control on the diet and taking frequent breaks in between, keeping yourself well hydrated with water. So all these are measures which can keep you active and healthy till these bad times are over. That's what I can advise you for now.
Yes, sir. Thank you, sir.
Thank you, sir. I would again request you to please guide us if these students find anybody who needs any help. How will they identify that there is some kind of a problem in a person in their family or neighborhood, there where they can extend any immediate help to somebody who's having a heart attack or something?
Always try and remember the symptoms of a heart attack. As I described in the slide, the patient usually will complain of chest discomfort in the upper part of the chest, and it's the heart pain is usually in the midline. It is not on the left, it is not on the right. Most of the time it is in the midline, and the the person will have difficulty in describing. He will just saying that he has a lot of discomfort, like someone has put a weight on the chest, or a lot of sweating, or maybe multiple vomitings, or the patient is, or the person is looking cold, clammy. So these are the signs that that means the person requires immediate attention. The person has to lie down immediately. Never keep standing because he will tend to fall and injure himself.
Okay.
Then call for the family, other relatives. See if the patient has any prior medical history or not. Try to contact the doctor or try and take the patient to the immediate nearby facility. And or if there is some emergency medication which has been prescribed by the treating doctor, then that can be given. But that's again a misnomer that should not give the anti-anal medications unless we are sure of what we are doing. Means that cannot give blindly a medicine that look, the heart attack is going on, let's give this medicine. No, we cannot prescribe any such medicine. So the best bet for the person would be to be taken to the nearest hospital. And secondly, all children and all persons should be trained in the basic CPR. That is a mandatory requirement. So that if you feel that the person is having breathing difficulty, you can start an immediate short CPR till the time that help comes. So yes. I think that the school should incorporate it in their curriculum how to do a basic CPR. That will be useful not only for the children but also for the adults.
Yes. Thank you so much, sir. And now, on behalf of my school, Alcon International, I extend a really hearty vote of thanks to you, sir, Dr. Aman Makhija. You have spared your time from your very busy schedule to grace this occasion today and give us such wonderful tips and a wonderful talk. You've enlightened our minds, and now we are going to be really more careful about our eating and how we are going to exercise. So we thank you all. We thank all the teachers and students for joining us today. Once again, sir, thank you for sparing this time for us. Thanks a lot, sir. Thank you.
Thank you, madam.
Thank you, sir.
Pleasure is all.
Thank you, sir.
Thank you, sir.
Thank you.
Thank you, sir.
Thank you, sir. Thank you.